40 million Nigerians are currently living with mental illnesses. Not 40,000, not 400,000, but 40 million people. That's like the entire population of California, moving as if nothing is happening, and everybody is counting them as one of the Nigerians who are just fine. The mental health situation in Nigeria is very bad. It is even worse here. You know, we have this reputation in Nigeria of being very strong people, that no matter what happens, we are going to thrive. Sometimes, depending on how difficult the situation is, we even turn it to humor, we laugh about it, and everybody is fine. Or so we think. And because of this reputation that we have exempted ourselves from the reality of having mental health issue. We kind of say that it is the white man thing, or these Oyibo people, they are going through so much issues. We are fine and strong here. But the statistics disagree. If you look at the numbers, you will see that the mental health situation in Nigeria is actually worse. I will be sharing some scary statistics about the state of mental health in Nigeria. And the goal is to just help us realize how bad this is, and for us to take our mental health more seriously. 7 million Nigerians have clinical depression. 4.9 million Nigerians have anxiety disorders. And we are not just talking about stress or overthinking, because that is, if we are talking about that, we won't find a broader number. We are talking about diagnosable, treatable medical conditions that people are living with every single day. Nigeria has the highest rate of depression in the entire of Africa. So, as we claim to be the giant of Africa, we are also the giant of Africa when it comes to being depressed. If we are as resilient as we say we are, the hardship that we are going through should not be leading to depression. But people are actually depressed, but we do not pay attention to it because we keep masking ourselves behind this image of strength. Nigeria ranks 15th in the world for suicide frequency, according to the WHO. Now, we are no longer talking about Africa again. We are talking about the entire world. There are 195 countries in the world. That's about 180 countries cannot relate to the amount of suicide we are experiencing in Nigeria. Yet we see it does not happen. It's just not being reported, or we don't talk about it as much as it is. But this is actually happening. Between 2020 and 2023, the suicide rate in Nigeria doubled. So this suicide rate that we're talking about is not something of the past, or it's not something that is getting better. It is something that is happening and getting worse. So if we continue based on the trajectory of what we are seeing, this 15th that Nigeria is ranked is probably going to increase, and we're going to see more people committing suicide in Nigeria. 85 to 90% of Nigerians with mental illness receive no professional care whatsoever. So if you gather 100 Nigerians who are having mental health issues, about 90 of them, nobody has taken care of them. It's only 10 people that have received care. It is actually very bad. 70% of mental health treatment in Nigeria happens through traditional healers and prayer houses, not clinicians. We have not come to a point in Nigeria where we acknowledge that mental health issue is actually a health issue. And if we want to even take a deeper look at the traditional method of dealing with people, some of the things you see is intense flogging or just locking them up as if they're in prison. So many of these traditional method of helping people with mental health illnesses is not even help, it is just complicating their situation. Over 60% of people who called the Lagos State Mental Health Hotline were active crisis situation. Either they were suicidal, they were violent, or they're completely breaking down. This shows a very negative pattern in our approach to help seeking when it comes to mental health in Nigeria. That people just go through their life knowing that they are suffering, but they do nothing about it until it gets to the point where it seems they have gotten to the height of it, they're about to die, then they seek help. Nigeria has never fully implemented its own mental health policy, and it was drafted over 36 years ago. So Nigeria, in 1991, they came up with a mental health policy. So okay, these are things we can do as a nation to help people who are going through mental health issues. And since from then till now, we have not seen the full implementation of it. In recent years, there have been more policies, but what we are pointing out in this point is that implementation is very poor. So even the new policy that have been drafted for mental health, there's no implementation, or we cannot boast of having successful implementation. Nigeria has approximately 250 psychiatrists for 222 million people. I mean 222 million people. And we only have 250 psychiatrists, not 250,000, not 25,000, just 250. You can fill 250 people in a room to address the entire psychiatric need of Nigeria. That is just pathetic. Now, still talking about professionals, there are only 1,000 psychiatric nurses and roughly 319 licensed clinical psychologists in the entire country. So if someone wants to argue that, okay, psychiatrists are not the only mental health workers that we need, there are other mental health workers who can respond to crisis situation. Even those other mental health workers, the numbers are still very pathetic. So there's no workforce to help Nigerians who need help. Up to 2/3 of Nigerian psychiatrists admitted to the fact that they are actively seeking to leave the nation. They want to Japa. So out of those 250 psychiatrists that are in Nigeria, 2/3 of them still want to leave the nation. So the trajectory of the workforce in Nigeria does not look positive at all. The Federal Neuropsychiatric Hospital in Japa lost half of its resident psychiatrists in 4 years. Talking about budget now, Nigeria allocates less than 4% of its health budget to mental health, and 90% of that 4% goes to just a handful of hospitals. The majority of Nigerians are not receiving anything out of the mental health budget. Like, the government does not cater to the mental health of the average Nigerians when it comes to budget. To give us some form of comparison, in high-income countries, the government spends averagely about $50 per person per year on their mental health. But in Nigeria, they spend less than $1 per person. So now dollar is about 1,300 at the time of this video. So the government in an entire year spends only 1,300 naira for you as a person and for me to take care of our mental health for the entire year. In the year 2018, the Federal Neuropsychiatric Hospital Japa had an approved budget of 133 million naira, and the government released only 10% or less than 10% of it. And in that same year, the number of patients they had increased by 22%. So we talk about how the budget is even very low. Now, out of the approved budget, only 10% of the budget was actually released for them to do the things that they need to do. The annual economic burden of mental illness in Nigeria exceeds 21 billion naira. And we already know that 21 billion naira is paid by the pocket of individual families. Among the internally displaced persons in Nigeria, I'm talking about people who were displaced by violence, 60% showed signs of depression and 16% had definite clinical depression. As a developmental psychologist, I would like to end with a statistics that talks about children. The prevalence of mental health disorders ranges between 10% and 37% among children. Yes, there is little, in fact, we can even say zero. There is zero dedicated funding that is targeted for children's mental health. Even the mental health of the entire nation, there's no funding for that. So what can we expect for children? So this is another generation that is growing up with a bleak reality already. The parents have suffered enough, but now the children are suffering. So if there's something you can do about it, first talk about it. Find something that is happening around you and be a part of it. If you don't want to join any organization, you as a person, try to offer some form of mental health help to the people around you. Secondly, if you can access care, do it. I want you to put aside this mindset that we are very strong people in Nigeria. The numbers show that we are not strong people. Nigeria is the 15th in the world when it comes to suicide frequency. So these are reality. If you can afford and access care, please do so. Thirdly, we should demand more from our government. I know the state of the nation. I know how things work here, but we can keep talking. We just have to keep talking. If our talking is not producing as much result, imagine how bad it's going to be if we don't talk at all. So we can hold the government more accountable and talk about these things. I'll be leaving the PDF of all the statistics in the description of this video. You can download them and even share them with people around you so they can see how bad it is.